Measures in Epidemiology Part 1. The outline of this session are Measures in Epidemiology, Measure of Disease Frequency and Mortality-related measures, for Measure of Association, and Measure of Impact will be in Part 2. The objectives of this session are to 1. Describe the importance of measures in epidemiology. 2. Explain the differences between incidence and prevalence. 3. Describe 3 types of measures in epidemiology, which are measure of disease frequency, measure of association, and measure of impact. The basic element of measures in epidemiology is knowing the magnitude of diseases or public health problems. Be able to compare disease occurrence among various population. In order to examine the importance of a disease, we need to be able to measure the deaths from that disease. Measures in epidemiology will aid public health sector to identify public health problems, allocate appropriate resource and monitor and evaluation of the disease prevention and control programs. World Health Organization defined health as a state of complete physical, mental and social well-being and not merely the absence of disease of infirmity. The definition of health or case definition is vital and meaningful in order to classify population into various groups, for example, individual with disease and without disease. Disease level in a population changes over time, so that case definition will be the tool to define each individual into the level of disease. The case definition needs to be valid, clear and simple, and should include clinical manifestations, person, time and place clearly. Before we go into the details, there are some definitions should be clarified. Proportion is defined as the comparison of a part to the whole, which the numerator is included in the denominator. Ratio is defined as the relative magnitude of 2 quantities or a comparison of any 2 values. Rate is defined as a measure of frequency which an event occurs in a defined population over a specified period of time. Proportion is the comparison of a part to the whole. For example, if a farm has 100 sheep in which 40 sheep are sick, so that the proportion of sick sheep in this farm is 40 divided by 100 equal to 40. Ratio is comparison of any 2 values. For example, if a farm has 100 sheep, in which 60 sheep are male and 40 sheep are female, so the ratio of male to female sheep of this farm is 60 to 40 equal to 1.5 to 1. Rate is a measure of event occurs in a defined population over a specified period of time, which calculate from number of case divide by sum of person time. For example, the rate of new HIV infection among men who have sex with men in Bangkok within 1 year are 5 men per 100 MSM population per year. Measures of frequency reflect the relative occurrence of the disease in a population. Measures of association reflect the strength of the statistical relationship between exposure status and disease occurrence. Measures of impact are used to predict the impact of an intervention on the disease occurrence in a population. The basic measures of disease frequency are incidence and prevalence. Before we describe how to calculate the incidence and prevalence, the population at risk needs to be understood first. Population at risk is a group of people who would be counted as a case. The importance of considering population at risk is illustrated by an example. In a study, the occurrence of cervix cancer, the population at risk would be female whose age can develop cervix cancer like female in 25 to 69 years. The data of the population at risk can come from demographic data, geographic data or environment data. For example, in a study of brucellosis outbreak in a goat farm, population at risk should be all farmers in the goat farm and butchers who slaughtered goats from this farm. Prevalence is defined as the number of affected persons in the population at a specific time divided by the number of persons in the population at that time. Prevalence is number of cases in a specific time divided by the number of population at risk at that time. Prevalence can be viewed as a snapshot at which we determine who has disease and who does not, but we are not determining when the disease developed. Prevalence is used in 2 ways: point prevalence, prevalence of the disease at a certain point in time, and period prevalence, how many people have the disease at any point during a certain time period. Example of District A. Point prevalence of diabetes mellitus cases at December 31, 2020 equal to number of DM cases at December 31, 2020 multiply by 100 divided by size of population at December 31, 2020 period prevalence of diabetes mellitus cases of year 2020 equal to number of old DM cases at January 1, 2020 plus no. of new DM cases in 2020 multiply by 100 divided by average population of 2020. Incidence is defined as the number of new cases of a disease that occur during a specific period of time in a population at risk for developing the disease. The critical element in defining incidence rate is new case of disease or new event. The incidence rate is a measure of risk. The denominator of an incidence rate represents the number of people who are at risk for developing the disease. The first type of denominator for incidence is all of individuals in this group have been followed up for the entire period. We call it the incidence proportion or cumulative incidence. However, often individual in the denominator has not been followed for the full time specified or death. When different individuals are observed for different lengths of time, we calculate an incidence rate. The denominator consists of the sum of the units of time that each individual was at risk and was observed. Incidence rate, also called person-time incidence or incidence density, is number of new cases or new events divided by the sum of follow-up period of individual at risk. Example of incidence proportion. In 2019, there is no sick cow among 100 cows. Then, in 2020, 30 cows develop foot and mouth disease from 100 cows. The incidence proportion of foot and mouth disease among cattle in this farm in 2020 is 30 divided by 100 multiplied by 100 equal to 30. Example of incidence rate. A study of incidence rate of ventilator-related pneumonia (VAP) in a hospital. In total year of 2020, there are 100 patients who are assisted by ventilator and the sum of ventilator-assisted days are 1,000 days. 20 patients develop VAP. So the incidence rate of VAP in this hospital in 2020 is 20 multiplied by 100 and divided by 1,000 equal to 2 cases per ventilator-assisted day. For the outbreak investigation, we speak of an attack rate as measure of frequency, which is defined as the number of people exposed to a hazard who became ill, divided by the number of people who were exposed to that hazard. For example, a food poisoning outbreak in school A, population at risk is only people who ate lunch. Crude attack rate is number of food poisoning cases divided by number of people who ate lunch. In an outbreak, disease can transmit from one to another, so we speak for secondary attack rate to measure disease's infectiousness. Secondary attack rate is number of persons become ill after exposed to the primary case divided by number of persons exposed to the primary case. In order to examine the importance of a disease or public health problems, we need to be able to measure the frequency of deaths from the disease. 1. Crude mortality rate is deaths from all caused, which calculate from number of deaths in a specific period divided by number of total population multiplied by 1,000 or any other figure. The number of total population at mid-year is generally used as an approximation. 2. Specific mortality rate. We can calculate a mortality specifically for a group of population. For example, mortality rate among children under 5 years is number of deaths of children under 5 years multiplied by 10 and divided by population of children under 5 years. 3. Case fatality rate. The mortality rate of specific disease which indicate the virulence of the disease. Case fatality rate calculate from number of deaths from the disease in a specific period divided by number of total cases of the disease. Thank you for your attention. This video was produced by Bureau of Epidemiology, Department of Disease Control, Ministry of Public Health, Thailand.